time and all those things, but I just need to speak with you about two glaring problems in this budget for people like me, and I hope people like you, who care about pregnant women and infants. First, North Carolina is rated 39th in infant mortality rates, and black babies are more than twice as likely to die than white babies. I hope that's upsetting to you. It's upsetting to me. That means more than 800 infants die in North Carolina every year. And now we have a budget surplus like we've never seen before, and this budget is ignoring that problem. That's not okay with me. The Office of Minority Health and Health Disparities that Senator Robinson talked to you so passionately about, they need more funding to do their important work. This budget doesn't do that. In fact, this budget makes these problems worse because it cuts off funding for the provision of other services like parenting classes, pregnancy prevention programs, even access to contraception. If those services are offered by groups like Planned Parenthood and even some hospital systems, cuts off the funding. Second glaring problem related to this topic that matters to me and I hope matters to you is that this budget funnels $3.3 million to just 3 organizations that have an extremely biased approach to the issue of abortion. One of those beneficiaries that gets this giveaway money is so extreme that it is classified as a hate group by the Southern Poverty Law Center. These so-called crisis pregnancy centers, they lure women in who either are or think they might be pregnant by appearing to be unbiased medical clinics, but they are not medical clinics. They don't tell women the truth about their options. They don't answer their questions with medically accurate answers. Their mission instead is to end all abortions no matter what. And they push that agenda by using deception, coercion, and shaming. That is an inappropriate thing to do under any circumstances, I submit to you, and especially inappropriate to do using state funds. So, to remedy these two glaring problems with the budget, I'd like to send forward an amendment. I believe it's with you.
Before we go amendment, clerk will read.
Senator Marcus moves to amend the bill.
You have the floor to explain your amendments.
Thank you. The amendment does two things to address the needs of pregnant women and infants in North Carolina. First, it strikes the limitation on the state funds for contraception, pregnancy prevention programs, and adolescent parenting classes. This ban is not only bad policy, but it's actually in direct violation of federal law, as held by a 2012 federal district court ruling. Secondly, it removes the funds that are earmarked for these crisis pregnancy centers and programs and moves them to evidence-based maternal health programs and other programs that address these health disparities in areas with the highest infant mortality rates. The programs that Senator Robinson spoke to you about earlier. These changes will put money into programs that will actually help women and children and encourage healthy pregnancies, especially minority women and children, with services like contraception, breastfeeding, smoking cessation, and parenting classes. The money will not fund abortions, let me be clear, because that's never allowed with state money. It's not what we're trying to do here, but it would fund programs that are better suited to promote the health and welfare of women and children. Let's use our budget to show that we care about women and infants by funding programs that help them. I urge you to support this amendment.